Good afternoon, everyone. I'm Becky Russell. I am far from a superhero like Dr. Lewis, but I would consider myself a super data user. So I'm really thrilled to see so many of you here today to talk about such an important topic. It is my honor and pleasure to be here to speak to the importance of vital statistics to maternal and child health, and to discuss how we at the March of Dimes rely on those data to help us achieve our mission. I've been at the March of Dimes for nearly 20 years, and it's I've really seen some remarkable enhancements and improvements to the vital statistics system over those years, and it's wonderful to be able to think about where it could go and how important it is that it go there. For those of you who might not be familiar with the March of Dimes, the mission at the March of Dimes is to lead the fight for the health of all moms and babies. We are a unique collaboration of scientists, clinicians, parents, maternal and child health experts, community organizations, members of the business community. We have volunteers all over the country and staff that are affiliated with offices representing every state, the District of Columbia, and Puerto Rico. As Senior Director of Applied Research and Evaluation, I am responsible for providing the organization with the data, evidence, and expertise so that our staff can advocate for better health for moms and babies, so that we can evaluate and improve our public health programs, to identify and target areas and populations at high risk in order to improve equity in birth outcomes, and to communicate our mission story. My job would be impossible without the vital statistics system in this country. Moms and babies need a champion, and right now, they need one more than ever. We have an urgent crisis facing moms and babies: increasing rates of maternal mortality and severe maternal morbidity, increasing rates of preterm birth, the opioid epidemic, and threats from emerging diseases like Zika threaten the lives of moms and babies everywhere. In order to protect the next generation, ensure that every mom and baby has access to necessary care, and work towards achieving equity in these outcomes, we need strong, reliable, and timely public health data sources. The March of Dimes Perinatal Data Center relies heavily on data from the Vital Statistics Program, specifically the birth certificate data and the linked birth infant death data, which combines birth and death certificates for all deaths that occur during the first year of life. And we use these data to conduct analyses to advance our understanding of trends and monitor the health of moms and babies. We also serve the public by providing easy and free access to these maternal and child health data. And these data can be used by program planners, policymakers, researchers, academics, and others interested in perinatal health to advance program planning and informed decision-making. Through PeriStats, which is a free publicly available website available at marchofdimes.org/peristats, the Perinatal Data Center provides the public with access to aggregated data from multiple federal and national agencies and organizations. Through a process involving NAPSIS and the National Center for Health Statistics, we obtain approval and are granted access to natality, linked birth infant death data, and fetal death data that include identifiers for states and counties, so that we can then aggregate these data on perinatal outcomes and provide data on both outcomes and risk factors for nearly every county in the United States. These data help illustrate the wide geographic disparities in these outcomes. Taking these data that are provided through our agreements with NAPSIS and NCHS, we provide simple access to these detailed data sets. So while I am a self-proclaimed data geek, I love p-values, I love regression analysis, I realize that the general public aren't. And so being able to have quick and easy access to these data that are available through maps, tables, charts, graphs, at a touch of a button to download them, I think is really quite a remarkable service and something that can help the staff at the March of Dimes, health professionals, researchers, and students, and it will give them the ability to better understand and describe disparities in poor birth outcomes and inform targeted maternal and child health programming and implementation. The Perinatal Data Center also uses vital statistics data to produce nationally recognized data products that are used both by the organization and our partners nationally and locally to raise awareness, build partnerships, and affect change in maternal and child health. Topics ranging from premature birth to birth defects and access to maternity care, we use vital statistics data to address important issues and engage stakeholders to help us find solutions and improve health. One example of this is the March of Dimes Premature Birth Report Card. Since 2008, the March of Dimes has published this report card to spur action by stakeholders on evidence-based interventions and advocacy priorities to reduce preterm birth, which is a birth that happens before the 37th completed week of pregnancy. We publish these report cards annually for all 50 states, the District of Columbia, Puerto Rico, and the US. These report cards are rich with vital statistics data, including state and county-specific preterm birth rates and indicators of racial and ethnic disparities in preterm birth. These state preterm birth rates are used to assess a state's progress towards reaching our ambitious goal of reducing the preterm birth rate to 8.1% by 2020. In 2017, using 2016 final natality data, 4 states had achieved our 2020 goal of a preterm birth rate of 8.1 and received an A on their report card. This report card generates national and local media coverage, which last year resulted in over 1,900 media hits and 60 million impressions. The 2018 report cards will be released next week on November 1st and will highlight the recent increases in preterm birth rates and the increasing racial and ethnic disparities. Together with our partners and collaborators across the country, we will use this report to amplify our messages, activate stakeholders, and raise public awareness of the seriousness of prematurity. We will be sharing with your offices links to the report and other resources, and we hope that you will all join us in sharing these through social media. As a community, we can create and implement solutions to address these rising rates and help achieve equity in these outcomes for all moms and babies. Earlier this month, March of Dimes released a new report entitled Nowhere to Go: Maternity Care Deserts Across the U.S. In this report, we investigated maternity care deserts, or areas in which access to care is limited or absent, either through lack of services or barriers to a woman's ability to access that care. This report begins to identify these areas by looking at the availability of hospitals, healthcare providers, and a means to pay for that care through health insurance. The report found that more than 5 million women live in these so-called deserts, and that nearly 150,000 babies were born to women living in these counties. Being able to use vital statistics data alongside data from the Census Bureau and the Health Resources and Services Administration, along with other national organizations and agencies, helps us to understand the scope of these limited access areas and the potential impact on outcomes. One aspect of access to care is the ability of women to afford that care and the availability of health insurance. This map shows differences across the country and the percentage of births that were covered by Medicaid. And these data are collected on the birth certificate and are included in the natality file released by the National Center for Health Statistics. Understanding how these rates of coverage differ within and among states can help us to determine effective strategies to improving access through such programs. And I just want to end with a comment that it's important to remember that these vital statistics are not just numbers. While I said I love data, I think they're powerful, I think they are impactful, and I think they can motivate change. These data and these systems capture the stories of real people. The twins born 10 weeks early who spend 6 weeks in the NICU before their parents can take them home. The baby born with a birth defect who doesn't survive to celebrate his first birthday. The new mom who develops preeclampsia after her delivery and can't get to the doctor in time to treat the life-threatening condition. We need to invest in these vital statistics systems so that we as public health professionals can quickly and accurately look at these data. To tell the collective story of the 4 million babies born every year, the 380,000 of them that are born too early, the 700 women who die from pregnancy-related conditions. Telling their stories will help us understand the causes, find solutions, and target appropriate interventions to improve maternal and infant child health. Hopefully one day, all the stories told in these data will have happy endings. But until then, we have to have the data to be able to help us get there. Thank you for this opportunity and for calling attention to this critically important issue. I look forward to identifying ways for the March of Dimes to continue to support the vital statistics system in this country, which provides such an incredibly important tool in our fight to improve the health of every mom and baby.